Okay, so to answer that question, it's a straight yes. It can be overwhelming sometimes, yes. And the reason being that some people don't understand the segments of the health as a whole. We have three segments in health. We have the primary health care, we have the secondary health care, and we have the tertiary health care. So many times people bring issues of primary health care to a tertiary institution. And it makes the work more, because there are some disease conditions that can be taken care of in a primary health care section. And if you bring it to us, of course, we don't want to send them home. We have to attend to them. So you don't even give us time to attend to the ones that we are in for. The tertiary, which is the teaching hospital, they are the ones to handle that. Then the secondary, the general hospital are the ones to handle that. So now, if we have plenty of this coming in, it can be overwhelming. And sometimes I hear people say, some health practitioners lie that we have no bed space. Yes, many times we don't have bed space, and we refer people according to their medical condition. So yes, sometimes it can be overwhelming. And that's why you can also help us to, make this thing easier. You're having malaria. What are you looking for in general hospital? You can go to a primary health care setting to get that resolved. You're having more intense condition. We have the secondary health care, we have the tertiary health care. And if there's no bed space, you can easily go to any other facility to get it resolved than we having the queue, and then the timing meets lots of many things we need to do. And then you can't be waiting on the queue for 2-3 hours and then you remain the same. We lose patients sometimes. So it's sometimes advisable, if you know the health condition can still go down the lane of primary health care, good. And if you can also go to other facilities, that's so good. But yes, sometimes it can be overwhelming, but not in all cases. Yes, we signed it for it, but of course we are humans. So there is a limit to how much we can do as a professional too. Thank you. There's no specific, okay, let's say for Lagos State Health Service now, we have scrubs and we have our main uniform, the white uniform. Of course, with the uniform, we have different cadres, but that's not what we are talking about. So for nurses, you can easily identify them with the white uniform. But if you're on scrubs, sometimes it could be confusing. And that's why we have our name tags. Right, you have our name tags, and sometimes you get to so maybe you did not see it. I would say you can ask people around. Okay, so who are this set of people? Are they carers? Are they health attendants? Are they portals? Are they nurses? Are they doctors? So sometimes maybe you will need to ask, because you never can tell. Sometimes uniform look alike. You can see a cleaner, you can see a portal, you can see an health attendant. Of course, it's still different in uniform scrubs, but you can ask to make it easier. Okay, so I would like to take off that specimen part.
Okay,
right?
okay.
But in a standard hospital where we have the nurses and doctors and the students, the interns and all, the truth is we do not leave interns or students on some specific procedures that must be done by the real person involved, right? We place them sometimes on thorough supervisions. We can't just leave them to handle things like that. We place them on thorough supervisions. They'll be supervised under us. If someone must be there for it to be done, but not in all cases. We have some basic procedures, sometimes vital signs done by student nurses. It can be done. We have physical examination, we have the auscultation, we have the palpation, all those. They're simpler ones that we know they are capable of doing, of course, still under supervision. So we don't use our patients as specimens, right? For some procedures that are more thorough and more deep, we use our practitioners, right? But there are some that can still be done by them under supervision, because if they don't learn in the field, there's no way they can know. We were also like them before we became professionals. So we don't use them as specimen. Yes, there are some basic procedures we do that they also learn under supervision. Thank you. Yeah, I think for we Nigerians, this is more on us because of our cultural belief. You know, there's this stereotype before that nursing is for females, while medicine is for males. And that's why sometimes if you see a female doctor, you call them nurses. If you see a male nurse, you call them doctors. These are two different professionals in a health team, right? And like I said earlier, when I was defining who a nurse is, an individual, male or female, they choose to be nurses while the other fields also choose to be doctors, right? It is two different professionals coming together to work together as a team, you know, to solve a disease condition. So a nurse can also be a male, while a female also can be a doctor. So there's no stereotype. A man can choose to be a nurse, a man can choose to be a doctor. And same goes to the female gender. So it is not gender based. It is that, you know, just like every other profession, you choose to be a nurse as a male, you choose to be a nurse, a doctor as a female. So sometimes you should not get it mixed up. If you say that, is this person a nurse? Yes, a male nurse. Yes, they are good nurses too. Thank you. So yeah, we've heard that times without numbers, which is not true, because when I gained admission into the university, or when I started as a student nurse in the School of Nursing, I entered with the same certificate, secondary school leaving certificate that carries the mathematics, English, physics, chemistry, biology, which is the same criteria for choosing medicine, right? And for me to choose nursing, yeah, it's a choice, right? Medicine is a choice. Every other field in the medical line, it's a choice. So there's nothing like because they could not make it to medicine. In fact, don't be surprised. We have some doctors that are nurses. Yes, and we have some nurses that are doctors. In case you don't know, not by the PhD level. We have people that they've once done nursing. They also studied medicine in some way. We have some people that are doctors in Nigeria, became nurses abroad. So it happens sometimes, but it's a matter of choice, not because I could not meet up with medicine. So I now came down to nursing, because both ways, it's not easy and it requires hard work.